So I'm having a rare day off from treating patients today, and I started to think, well, do people understand what the study is that I'm doing that is matching Arthrosamid, that knee gel that we inject into people's knees, and Shockwave and EMTT? Do they even understand why I'm doing it, what the process is? And I didn't know, so I thought I'd try and condense that into a very short video. So what we understand is that the hydrogel, the non-degrading hydrogel that's called Arthrosamid, can be injected into the knee, and that acts like a scaffold, a natural scaffold inside the knee. Shock absorbency, it aligns itself with the knee capsule, pushes all that unwanted fluid out of the knee and lines that synovium and stops that sort of angry inflammation process being in the knee. Squeezes it all out and keeps it out, stays in there forever. And that's really good for kind of stopping the osteoarthritis in its tracks. But it's not really doing masses for the actual joint surfaces itself. And what we know from Shockwave and extracorporeal magnetotransduction therapy, there's a reason we call it EMTT, is that they work on the bone cells themselves and actually rejuvenate that. So we're actually winding the clock back a little bit on that knee joint, on those surfaces. So we're attacking this knee OA from two positions. One is we're softening the impact and stopping that harmful inflammation. The other one is we're actually making the bone surfaces themselves better. So we're rejuvenating it. And those two things slow osteoarthritis progression from a sprint to a crawl. It really slows it down in the majority of people. So some people are registering within 2 days, they feel immeasurably better. Some have had to wait 5 months to get a difference from the gel. EMTT acts a bit quicker. Shockwave takes 2 to 3 months to reveal its full processes. But if you consider it can be 9 to 12 months rehab from knee surgery, and if you don't get something done, your knee's just getting worse and worse and worse. Waiting a few days to a few months for this combination of services to work is just no time at all. And so I really think people should consider trying it. Yes, it's not the cheapest. It's less than a third of the price of having knee surgery if you pay for that privately, but it's definitely worth considering. And you know, the best bit is if it lasts for 5 or 10 years and then runs out, you can have it done again. And if that works, you can have it done again. So you may be delaying or offsetting knee surgery forever, regardless of your age. The earlier that we get in there, I think the better. So as soon as someone said to you, you've got early stage knee OA, we should start having a conversation.